What are the best exercises for thoracic outlet syndrome? Finding the best exercises for thoracic outlet syndrome can be really confusing because thoracic outlet syndrome is a rather confusing thing in itself. Hi, I'm Dr. Dave Candy, and in this video, I'm going to describe what exactly thoracic outlet syndrome is, what the two main classifications of thoracic outlet syndrome are, and why it can be really confusing to find the right exercises for thoracic outlet syndrome. Now, if you find this video helpful, give it a like and subscribe to our channel so you can get notified of our future videos. Now, I want to start out with a story. Back when I was working in a hospital-based physical therapy clinic with a lot of different physical therapists, when a diagnosis of thoracic outlet syndrome would come in, everyone would kind of run for the hills and say, "Do you treat thoracic outlet syndrome?" Like nobody wanted to treat it. Because when an ankle sprain happens, everyone kind of knows what an ankle sprain is. But thoracic outlet syndrome can be confusing for patients if you've recently been diagnosed with it, and for clinicians alike. And so finding the best exercises can be really hard because thoracic outlet syndrome isn't just one thing. In fact, really anytime you slap the term syndrome on it, it's a fancy medical word for we don't know exactly what the heck it is. And usually that's because it's a heterogeneous problem. That means it's not just one thing, it's a bunch of different things that kind of sort of have the same set of symptoms, and we try to lump them all together. But really, to effectively treat thoracic outlet syndrome, you have to break it down into its component parts and understand each of the things that contributes to the problem so that you can get the best exercises or whatever means of treatment to get it better. So what is thoracic outlet syndrome? Now, really, it's kind of a funny name because your thoracic outlet is truly this area, your inferior thoracic aperture, the part underneath your rib cage, and the thoracic inlet is up here. But thoracic outlet syndrome, for some odd reason, was named for a compression of nerves or blood vessels between your first rib and your collarbone in the thoracic inlet, which happened to be named thoracic outlet syndrome. But we'll let that slide because everybody just kind of knows it as thoracic outlet syndrome. So what are the two main classifications of thoracic outlet syndrome? Well, I mentioned it affects both the nerves and the blood vessels that come out of the thoracic inlet. And those are the two main classifications, a neurogenic thoracic outlet syndrome and a vascular thoracic outlet syndrome. So what are the symptoms of a neurogenic thoracic outlet syndrome? Well, that's basically a compression of the brachial plexus, a bundle of nerves that comes out of your neck, goes down through your thoracic area between the first rib and the collarbone, underneath your chest muscles, in front of your shoulder, and then eventually down into the arm. And the main symptoms that people get with neurogenic thoracic outlet syndrome are numbness and tingling, most commonly in the little finger and the ring finger, although it can affect a lot of different areas depending on what part of the brachial plexus is affected. But usually it's the lower trunk, the lowest part of the brachial plexus, where it passes through either the scalene muscles in your neck, the first rib and the collarbone, and the chest muscles down in this area, in that thoracic inlet or thoracic outlet area. Before we describe the specific components about that neurogenic thoracic outlet, I first want to describe the other form of thoracic outlet syndrome, the vascular form of thoracic outlet syndrome. And that's a compression of either the subclavian artery or the subclavian vein that runs between your collarbone and your first rib. Now, the subclavian artery is a main branch off of your aorta. So if you don't know what your aorta is, it's the big, huge artery that comes out of your heart, and it goes both up and down, but the superior aorta comes up, and then it branches into your subclavian arteries on both sides. So that subclavian artery is a pretty big, important artery. And if it gets blocked between your first rib and your collarbone, it can create some serious issues. The most common thing is to feel weakness or coldness in your hand, or you can even see like a bluish discoloration. Now, that type of thoracic outlet syndrome is truly most commonly caused by either the collarbone being too low and being pulled down into the first rib. For example, if you carry heavy things in one arm all day and it pulls your shoulder blade down, or if you tend to lean more on one side than the other side, and you do that over and over a long period of time, Those are things that can depress or lower your shoulder blade and your collarbone on that side. And over time, that collarbone coming down can compress the subclavian artery, the subclavian vein, or the lower trunk of the brachial plexus, the nerve bundle. The other thing that can compress the nerves or the vessels between the first rib and the collarbone is if your scalene muscles in your neck are too tight. You have some muscles right up in here that attach to your first rib, and a lot of people are surprised just how high your rib cage goes up. That your first rib, you really can't feel it, but it's right almost underneath your collarbone. So there's a tiny little narrow space that the subclavian artery, subclavian vein, and the brachial plexus all have to run through. And if there's just a little elevation of the first rib or the collarbone's brought down just a little bit, it can cause some issues. So what are the different causes of the neurogenic thoracic outlet syndrome? And that's by far the more common thing, the more common form of thoracic outlet syndrome that people experience. And that can give you a numbness and tingling in your arm or in especially your little finger and your ring finger, but it can be mistaken for a C8 problem in your neck. It can be mistaken for an ulnar nerve problem somewhere in your inner arm, especially in your elbow, or sometimes even in your hand. So you have to find out and make sure that it is actually coming from that thoracic outlet. Now, what are the various things that can compress that nerve? It can be actually the nerve roots, which would truly be more of a neck problem, not truly thoracic outlet syndrome. Moving out from there, it can be stiffness in the scalene muscles. That nerve bundle can get compressed between stiff scalene muscles in your neck, these kind of tendinousy ones on the side there. It can get pinched in there. The next place is if your collarbone is too low or the rib is pulled up too high, that bundle can get compressed between your collarbone and your first rib, and it can get compressed right there and create some symptoms into your arm. The next place is in your chest muscles. Your pectoralis minor, your chest muscle, runs from your rib cage out to a little hook on your arm here. And if that's too stiff from sitting with your shoulders like that in front of a computer all day, for example, it can put pressure on your brachial plexus as it runs through your chest. And finally, that bundle passes in front of your shoulder blade as it goes into its branches. And if you have a hypermobile shoulder that kind of dislocates a little bit or moves a little bit too far forward in the socket, it can put pressure on that bundle, particularly when you're in positions like throwing a ball where your arm's back like that. If the ball comes out a little bit too far forwards, it can bump into the nerves and give you some irritation there. So no wonder it's so hard to find the right exercises for thoracic outlet syndrome, because it's not just one thing. It can be any of a few different things. And really, to find the right treatment for it, you have to figure out which one or ones of those things are the causes and address those specific things. So let's talk first about if the brachial plexus is being compressed by these scalene muscles in your neck. What do you do for that? Well, ideally, you want to stretch those muscles out so that they're not so stiff or tender. Now, if you just stretch your neck like that, if those muscles are already stiff, they're just going to pull the collarbone up even farther, and that's going to create more problems with your thoracic outlet syndrome. So you need to do something to hold that first rib down. Putting a towel over your neck to help hold the first rib down while you stretch your muscles allows you to stretch the muscles and actually lengthen the muscles rather than just pull the attachment point of the first rib up. And I've got another video that I'll link to that shows you the exact technique for doing that scalene stretch, or sometimes it's referred to as a first rib mobilization. Now, that same technique can be used if you have a first rib that's pulled up too high. And in fact, if you have a first rib that's pulled up too high, it's really rare to find that your scalenes aren't stiff. So they kind of go hand in hand, and the same technique will help you to fix both problems. Now, another common thing that people who have a elevated first rib and stiff scalenes do is they tend to breathe with their neck. That when you breathe from your upper chest, it uses your neck muscles as respiratory muscles or breathing muscles, but they're not really supposed to be your primary breathing muscles. You're supposed to breathe with your diaphragm, which is a dome-shaped muscle at your true thoracic outlet, down underneath here. And so by breathing with your belly, kind of pushing your belly out as you breathe in and then letting your belly passively fall as you breathe out is truly the best way to breathe. It's the most efficient way to breathe, where you get the most oxygen. It helps decrease stress. It helps decrease pain. It releases all kinds of good, happy hormones from your body. So diaphragmatic breathing is good for thoracic outlet syndrome, as well as a variety of different pain problems. And it also helps relax your scalene muscles so that you're not compressing the nerves in your neck or thoracic outlet. Now, the next problem is stiff chest muscles, and particularly the pectoralis minor, the little muscle that runs from your sternum down to a hook on your shoulder blade. And that nerve bundle runs through or underneath that pectoralis minor, and it can get compressed, particularly if you do a lot of bench press or chest exercises, or if you just sit all day typing at a computer, hunched over with poor posture. So obviously fixing the posture issue is a big component of that. And no matter how many stretches you do, if you're doing this all day long and you stretch your chest muscles for a few minutes, it's not going to make a big difference unless you fix the overwhelming problem that you do all day, every day. And so it is important to make sure you're keeping your shoulders slightly pulled back, not excessively. Your upper back is supposed to be a little bit rounded forward, but you don't want to be sitting with your shoulders extremely rounded like that all day long. For women, good bra support is also important, especially women with a larger bust size, that if you have a lot of weight pulling you downwards, then it's going to pull your shoulders forward. And so getting a good supportive bra and having it hit closer to your neck so that it's not pulling your shoulder blades down and pulling the collarbone down lower is something really helpful for women. Sometimes actually a breast reduction for people who really are a little bit larger is a medically necessary expense, and sometimes your insurance will even cover it if that's a problem for you. Now, what are some other things you can do if you have stiff chest muscles? Well, again, you need to fix the posture problem, but stretching your chest muscles can be something helpful also. And the best way to stretch your chest muscles is some form of having your arms up like this. You can do it laying on your back, you can do it laying on a foam roller, you can do it standing with your arms in a doorway, or you can do it just standing with your back up against the wall, trying to pull your arms up like that. And again, I've got another video that I'll link to that shows you the best way to stretch your chest muscles or your pectoralis minor. Now, finally, what if you have an unstable shoulder? If you go back like that and the ball of your shoulder kind of pops forward in the socket, it can put some pressure on that nerve bundle. That's particularly common in people who are hyperflexible, just generally are really bendy and stretchy. It's also common in people who have had a shoulder dislocation at some point in the past. And if that's you, strengthening your rotator cuff muscles is really important. It's also important to stretch out the muscles in the back of your shoulder, because if the back of your shoulder is too stiff, the ball is going to go forward and go to the front of your shoulder. So I'll link to a stretch called the sleeper stretch that helps you stretch out the back of your shoulder, as well as some exercises to help you strengthen your rotator cuff muscles and help you keep the ball of the shoulder centered inside the socket so it doesn't push out and press on your brachial plexus. So that was probably a little bit overwhelming. And again, if you feel a little overwhelmed after watching this, don't be. Even clinicians, many physical therapists, doctors, or other medical providers get kind of confused with thoracic outlet syndrome. So it is important to find someone who understands the problem, can help break it down into its component parts, and help you get the right treatment for it. Now, if you happen to be in the St. Louis area, we'd love to help you out with that at More for Life. Our specialists are trained to be able to break things down into their component parts and help you find the root causes so you can fix those components and help you address the problem, not just to get temporary relief, but to find long-term relief. And if you happen to be somewhere else, but you're watching this video and you found it at all helpful, give it a like and subscribe to our channel so you can get notified of our future videos. Thanks for listening and have a great day.